Hi, my name is Grace McDonald, and in this video I will be interpreting laboratory results using the SBAR communication method as well as the Universal Nursing Lab interpretation decision tree. So, starting with the S, our situation is why is the patient in the hospital? Our patient is Susie Smith. She is 48 years old. She's a waitress at a busy restaurant. She smoked cigarettes for 20 years and she's been vaping for 3 years. She has minimal exercise and family history of heart disease. She's currently on Lasix and IV solution of normal saline at 100 milliliters per hour. Her presenting complaint is new onset chest pain. So B for background would be our history and medications, which is the smoking history, minimal exercise, family history, and then her medications that she's currently on, like the Lasix and IV fluids. A would be assessment, would be all the lab tests that were ordered. Miss Susie had an EKG ordered, her troponins, a CMP, a BNP, CBC with differential, lactic acid, a D-dimer, thyroid panel, calcium scoring, echocardiogram, chest x-ray, and nuclear medicine testing. And R would be recommendation. Anticipate the next steps, teaching, consults, etc., So, the most concerning findings include BNP, her troponin, D-dimer, liver enzymes, and procalcitonin, along with changes in her kidney function and electrolytes. These results suggest the possibility of heart failure, infection, or sepsis, which are all like a big no-no. Sorry, I'm reading my script. Possibly organ stress or damage as well. The patient's laboratory data was collected over several days, which allows us to observe trends rather than looking at just one test. Normal ranges are used to determine whether each lab is high, low, or within normal limits. The decision tree helps identify potential causes. So, many of these labs evaluate cardiac function, infection, kidney function, liver function, electrolyte balance, thyroid function, which they all kind of like work together to help paint a picture of the patient's overall well-being. Using the decision tree, I will first compare each lab value to the normal reference range and evaluate the trend over time. First, looking at the cardiac markers, let's see where we're at. Cardiac markers and the BNP. So that would be right here. Lost my spot. Oh, BNP or B-type natriuretic peptide. It should normally be less than 100 picograms per milliliter, and this patient, hers is 842, which is significantly elevated, like it's very high. And for that test, we only have one result, so it was only tested on admission, I'm guessing. So BNP is used to help diagnose and determine the severity of heart failure. And the elevated levels indicate that the heart is under stress and it's struggling to pump efficiently. The lab results support that the possibility that the patient is experiencing heart failure. So the nurse should assess for symptoms such as short of breath, fluid retention, edema, like the feeling of your heart kind of pounding out of your chest. Next is troponin 1, which is right here. It should be less than 0.35 micrograms per milliliter. And her first was 0.12, which is normal. Her second was 0.35, which is also normal, but it's trending up. And then her third was 0.50, which is significantly elevated. Elevated levels may indicate cardiac injury or a heart attack, which is an MI or myocardial infarction. It could also be like heart injury, heart muscle injury. If levels continue to rise, it could suggest reinfarction, meaning additional damage to the heart. Like if you already had an MI, it could mean you're having another one. Next up will be the cardiac calcium scoring. This should be 0, but hers was 150 for all 3 days. This indicates a moderate amount of calcified plaque into her arteries. This increases her risk of coronary artery disease and possible cardiac injury, which may require further testing, so I would educate her and prepare her for further testing. Let's see, where was I at? Next, I evaluated the markers for infection and inflammation, which would be our I believe it would be our CBC with differentials. So for her white blood cell count, the normal white blood cell count is between 4,000 and 11,000 cells per microliter. And this patient's white blood cell count shows an upward trending. So her first day was 7,200, her second day was 12,500, and then the third day was 17,000, which is trending up. This pretty much indicates infection. Or it could be inflammation too. Looking at the white blood cell differential, the patient shows an increase in neutrophils and her platelets. The lymphocytes were kind of high when she was in there, but it was also like within the normal limits, and now it's trending downwards, which is decreasing. That could mean stress, infection, or like immune suppression. Like if you're drinking alcohol or just working yourself or even being stressed out can like suppress your immune system. Elevated neutrophils are commonly associated with bacterial infections and inflammatory responses. Well, another important infection marker is lactic acid. The normal range is approximately 0.5 to 1 millimoles per liter. Yeah, that's what that is. Her first one was 1.5, which was high. Her second one was 1.4, which is still high. And then her third one was 0.03, which was low. But you kind of want it lower than higher. She could be having a severe infection like sepsis, or she could be having poor circulation. This would require rapid medical intervention. The procalcitonin is also elevated in this patient. Procalcitonin is a marker used to identify bacterial infections and sepsis. When levels increase, it strongly suggests the presence of like a whole body infection, which is an important indicator for early sepsis. So next, we will look at her D-dimer, which should be less than 250 micrograms per liter. Her first one was 300. They didn't do a day 2, and then day 3 was 620. This is extremely elevated. This can indicate a blood clot, like a pulmonary embolism. You could have like a clotting disorder. I would recommend further diagnostic testing. This is also caused by DIC, and it could be caused by pregnancy and sickle cell disease. Although our patient is 48 years old, so I don't think she would be pregnant, but I don't know. Next, we will look at our BUN levels. BUN, where are you? Okay, right here. So the normal levels are 8 to 20 milligrams per deciliter, and the first day we started off at 15, which is pretty normal, and then the next day we went up to 18, so we're kind of trending up, and then the third day we were at 22, which is a little higher. This is to evaluate the kidney function. It could indicate disease, dehydration, or urinary obstruction. We're pretty much just looking at the kidney here to evaluate the function for it. Next, we have the creatinine, which the normal levels are 0.6 to 1.2 milligrams per deciliter. Day 1, we are at 0.9. Day 2, we are at 1.2, which is like our max, and we're increasing a bit. And then day 3, we're at 1.4. This is to assess your, how do I say that? Your kidney filtration and possibly like if your kidney's dysfunctioning. So that's something to keep an eye on, and I would definitely do another set of labs for this to double check maybe the next day and see if it's still increasing. Next, we will be doing the AST and ALT. These are both to check for liver disease. It's like, it can help in detection of acute hepatic diagnosis, or it can also help you distinguish between myocardial and hepatic tissue damage. They're both elevated in this patient. Normal levels are 15 to 30 units per liter, and then ALT is 8 to 35 units per milliliter. Day 1, we started off kind of normal, and then after that, we went up to trending upwards and pretty high. This could indicate liver injury or inflammation. So next, we have the total bilirubin, which is milligrams per deciliter. You kind of want this less than 0.5. She started off at 0.6, and then she's trending upwards, 0.8 to 1.2. This could indicate hepatic injury or biliary obstruction. It could also be associated with liver disease, bone disorders, or bile duct obstructions. Next, we would evaluate her electrolytes. That was our first one, right? Yes, so we'll start with sodium. Normal levels are 135 to 145 milliequivalents per liter. The patient's sodium is slightly trending downwards, but it's still within the normal limits. It's 138 for day 1, 136 for day 2, and 134 for day 3. This tells me her electrolytes were normal, but they're starting to trend down. So normal potassium levels are 3.5 to 5 milliequivalents per liter. And we started off at 4.2, then we went down to 3.8, and then we went all the way down to 2.6. So this could be due to excessive fluid loss or respiratory alkalosis. Could be due to medications or metabolic conditions, and it could lead to cardiac rhythm disturbances, which may occur in like alkalosis, whether it's metabolic or respiratory, or it could just be a fluid imbalance, like if she was vomiting. So finally, I went over her thyroid panel, and her TSH, it should be 0 to 1.5 microintentional units per milliliter. We started out as 0 to 1.5. No, 0 to 15, excuse me. I confused myself there. So day 1 was 2.3, day 2 was 2.8, and day 3 was 3.1. So these are all within normal limits. This is telling me that the patient's thyroid is not the problem. So for our T4, normal limits are 5.4 to 11.5 micrograms per deciliter. We're starting at 1.1, which is really low, and then we go down to 0.9 and then 0.7. So this is caused by primary or secondary hypothyroidism, and I would prepare the patient for further testing since our TSH was normal. Yeah, I don't think it's contributing to the patient's current condition, but she could also have this as an underlying condition. Based on the abnormal lab findings and the trends, The patient should be closely monitored for heart failure, infection, or sepsis, or all of the above. I would check her kidneys and liver every day and make sure that everything is going good with there. The recommended nursing actions would be watching her cardiac markers and BNP, assessing her symptoms for heart failure, monitoring infection markers and vital signs for signs of sepsis, like if her temperature's high, that could be a good sign. I would evaluate her kidney function and track her input and output with her urine. And then I would check the liver enzymes and her bilirubin levels. And then I'd correct the imbalances in her electrolytes. And I'd prepare the patient for additional diagnostic testing if it was ordered by the healthcare provider. So, in conclusion, using the SBAR method and the Universal Nursing Lab Interpretation Decision Tree is really helpful. It helps you analyze the lab results, identify abnormal trends, and communicate critical information to your healthcare team. This improves clinical decisions and supports safe and effective patient care. Let me double check that I did everything right. Okay, thank you.